We would like to acknowledge the Yuggera people and the Turrbal people as the traditional custodians of Meanjin, the lands on which we record this podcast today. We pay our respects to elders past, present and emerging. Always was, always will be, Aboriginal land. Hello and welcome to another episode of For the Health of It, a podcast made for healthcare professionals by a nurse on the inside. So my name is Jess Tully and I'm a registered nurse myself, but I'm also the Brand Ambassador of Healthcare Australia. Now today's episode is going to get you in all the feels. Trust me, I was extremely emotional and teary during this episode, and after we recorded, I really had to take some time to myself just to be like, ooh, that was heavy. So a bit of a warning, I guess, before going into this episode. It is quite heavy and it is quite confronting and just all round emotional. Okay, you're going to get a wave of emotions. So I interviewed Lynette Maguire. Lynette runs not even a national charity. It's actually branching out to an international charity called My Wedding Wish. So she wears many hats, but one of her roles is actually a marriage celebrant, and she's done hundreds and hundreds, probably even hit 1,000 weddings. She honestly has done so many weddings, and she goes through the story through the podcast episode about a situation where she married somebody who was palliative care and passed away 24 hours after the wedding. She's never been involved in the medical world. She's never been experienced palliative care and end of life kind of situations. So for her, it was quite a wave of emotions that she had to kind of deal with, and it was really heavy. But what she had done was made such an impact to that family and to that couple, and she decided to launch My Wedding Wish, and it's designed to help people that are end of life palliative care and actually throw weddings together. So she has wedding suppliers all over Australia and now in New Zealand as well, and she can throw together weddings so quickly for those people that are really undergoing, I guess, hardship in life, when it comes to medical diagnosis and things like that. It's a really heavy episode. Lynette is absolutely amazing. I love her energy and I love her passion. The way she speaks in this episode, honestly, she's an incredible human being. And this episode is about spreading her voice and spreading kind of her love with this charity as well. My Wedding Wish is going to continue doing amazing things, but like any charity, every charity needs help, financial help, and also to spread the word. So listen to this episode, feel the huge wave of emotions like I felt. Make sure you spread the word. And if you have any ideas to help this charity grow, please reach out to Lynette. So it's called myweddingwish.org. Have a little look on the website and just dive into this episode and grab some tissues because it's really emotional. All right, everyone, enjoy. Bye. All right, a huge welcome to Lynette. I'm so grateful that you came on For the Health Bit podcast today to have a chat about My Wedding Wish. So huge welcome to Lynette.
Hey, Jess, thanks for having me.
Thank you so much for joining us today. Honestly, I've been really excited to hear your story and to hear about how My Wedding Wish started. I have done some deep dive stalking into this amazing charity and you as a person as well. I would love to start this podcast to know a little bit about you, Lynette, before My Wedding Wish started. Go ahead. Tell us about you.
Well, that's a long story, seeing how old I am.
No.
I'm a Queensland chickie, and I wear a lot of hats. So I'm a marriage celebrant. I run an elopement business. I run, obviously, the charity, and I also teach at the University of the Sunshine Coast. I've written a couple of books, so I'm an author. I'm a researcher. I'm just looking at doing a second PhD, and I'm a speaker, so I do speak a lot for My Wedding Wish, but I also speak about some of my research, which is my first PhD was all about basically the impactors of social media on teen mental health. So my areas of expertise in that arena are all about suicidality, narcissism, increase of violence, all of the stuff that nobody else wants to touch.
Wow, you absolutely do wear so many hats, don't you?
I know,
And they're all
I
so
need a few more
different.
heads. I know, and it confuses people going, is this the same chick that is? But anyway,
Yeah,
it is what it is.
absolutely.
Yeah, and it's really difficult. And the only reason I keep them all is because I love them all. And I can't, it'd be like Sophie's, is it Sophie's Choice? You know, the movie where she had to choose between her two kids. I can't do that. So I'm
Absolutely.
just,
I love that you're doing all your passions and you've combined them
yeah.
all, even though they're so different.
Yes, yeah. And there's another hat to be added with another PhD. But anyway, that's another thing.
I don't know how you have the time, but I'm so grateful that we're even able to lock in this podcast. Two very
Yes, yeah.
busy women, but my goodness,
Yes. Well, you know what, Jess, I am the queen of time management.
I can tell. Absolutely.
That's all I'm going to say. I'm very good at it.
Wow. So the PhDs like that, I would love to just dive into that. But obviously, today's focus is about my wedding wish.
Yep.
So, how did my wedding wish start? I've had a look online and I know of the story that you've got online with the transcript.
Yep.
And that was just such a beautiful, touching story. But I'd love to hear it from you. How did my wedding wish
Okay.
start?
All right. So my wedding wish started, and I have to correlate it to my university journey because I was doing my undergrad, and my undergrad is psychology, and I had three essays due, and I got an. And I think I had 11 weddings that week. And, I'm a full time mum, or was back then, and worked part time and went to uni for it. Was just, it was just a big pile of life. Anyway, I got this email, not this email, this letter to say, can you come to jury service? And like an idiot, I said, yeah, sure, I can fit jury service in amongst it all. And anyway, so I went to jury service that morning thinking that afternoon I could just dive into one of these psych assignments. And when I got back from jury service, I had this phone call, and this fellow said, you're a marriage celebrant? I said, yes, I am. He said, my son is dying of cancer, and his dying wish is to marry his fiance. And I said, okay, well, where are you? He said, Maroochydore. And I said, okay, well, and all I could think about was these psych assignments. And I said, okay, well, I can be there on Thursday. And this was the Tuesday. And he said, I don't think he's going to live until Thursday. And I said, okay, well, I'll be there in an hour. So I parked my life and went over to his house. And the family, the whole family were from New Zealand, but he was living over here with his fiance, and they had rented this house in Maroochydore. And I'd walked in, and all the lights were down, and there was a palliative care bed in the lounge room. And so it was walking, and it was very hush hush, and very somber, as you could imagine.
Mm.
And he was lying on the palliative care bed. He was a 23-year-old fellow, and with his fiance, and she was lying on the bed, and she was rubbing his face and doing all the I love yous and stuff like that. I was just, I don't know whether I can do this. Anyway, I spoke to her. I couldn't really speak to him because he was like tired and what have you, and he knew other people were going to do the talking, so that was fine. Anyway, normally if you're going to get married, you need a month's notice. Okay, so if you put your notice of intended, that's the form you need to fill out, to me today, the 12th of July, the earliest you can be married is the 12th of August. Okay. So that's the legal requirements, but there are ways, or there is one way that you can bypass that, so you could get married this afternoon, and that is to go to the magistrate's court. At that stage, now you have to go to the births, deaths and marriages, but at that stage, this is back in 2007, you had to make an appointment with a magistrate and go and prove with the fact that like you're going over to Afghanistan to shoot people or what have you, or in this case that you have a medical issue and you don't have the month. And so I rang the magistrate's court, made the appointment for 1 o'clock, and the fiance and mum went down with all the medical paperwork, the notice of intended marriage, which they'd filled out and had signed in front of me and what have you. And I knew it would be passed. It's just a rubber stamp type thing. And anyway, in the meantime, I'd organised for a photographer friend of mine to come over, and a florist with a little bouquet and stuff like this, just like a mini little elopement put together. And they had their friends all come around that afternoon. So the mum and the fiance came back, and they were back at about 3:30 or 4 o'clock or something like that. And so we got them married. Now one of his dying wishes was not only to marry his fiance, but was to walk to his wedding. And the wedding was on the veranda of this old Queensland house. So his palliative care bed is in the lounge room. And if you can push your head into seeing any like smallish type Queenslander homes, it's not far. It's about 15 steps, and you could see that those 15 steps were really painful. You know, they hurt a lot, but he didn't, and he really wanted to do it to walk to his wedding. So he walked to her, and there was a big plush chair there, and so he sat down in the chair, like very proud of himself that he'd walked there. And it wasn't a long ceremony. He couldn't handle a long ceremony, so it was just almost to legals only with a few nice words thrown in. And I got them married. I married them that afternoon, and it was the most heartfelt ceremony I think I've ever done, and I've done 1,600 of them.
Wow.
Yeah, and it was beautiful. I said goodbye to everybody. I got the photos. The photographer organised for the USB and what have you to get sent over. Anyway, I got the phone call that he actually died on the Thursday. So, yes, he had one night as a married man.
Wow.
So
And
that's,
imagine he said that as well, didn't he? He said he's not going to last till Thursday.
yeah. So they end up shipping his body back to New Zealand and having the funeral over there. Normally, if they're Queensland Sunshine based, North Brisbane based, I'll do the funeral for nothing as well. It's just a part of, I sort of think it's, like you become part of the family. They become part of my Wedding Wish family, and I become part of theirs, whether they like it or not.
Yeah.
So I usually do their funerals as well. But in this case, I didn't. But it actually got me thinking, and I sort of thought, when I'm not so busy, I'm going to do something about this, because he's not the only poor bugger that's dying, and all he wants to do is marry his girl. And like how unfair that these people, the majority of our clients are like 23 and 24 years old, and they have no idea what it's like to just plan a wedding with the joy and the, oh, what color am I going to have, and do I have the tiara, do I have the sash, do I have the veil, it's that sort of thing. They have no idea what it's like, because they're hooked up to a machine, or they're so overwhelmed with having to look after someone who's dying or dying themselves. Depends on who the sick person is. So it's one of probably the messages I'd like to get out, is that we actually do take marriage, and it's a beautiful rite of passage. We do take it for granted, and people that organise their weddings with just the joy, well, hopefully it's joy, just the joy of organising a wedding, they really have no idea what it can be like if the coin was flipped and it landed on the other side.
Yeah, absolutely. Like, what an emotional day for you as well, like having to do your jury duty, and then you got your focus on this assignment, and then this phone call out of the blue. Like, that is so incredible that you made that choice to go, no, I'm coming to help you.
Yeah.
But the emotions that you would have felt coming home that day, had you ever been exposed to someone in palliative care yourself, or anything to do with the medical world?
No, that was my first one. That was it was pretty confronting.
Very confronting for anybody that I guess hasn't been exposed. Like this, obviously, this podcast is aimed more so at healthcare professionals. So we see palliative care every day, and we see those beautiful, beautiful couples that don't get married, and it is so horrible to witness this. But what you have done for that couple and for that family was just the most incredible gift you could have ever given him in the whole wide world.
Yeah.
So he would have passed away being such a happy man that he got to marry the love of his life.
He passed away as a husband. And I think that was important to him and important for her. The interesting thing was, the photographer was walking through the Sunshine Plaza a couple of years later, and she bumped into the fiance, and the fiance burst into tears, and she said, "Oh my God, you're the photographer." She said, I lost the USB stick."
Oh.
And Kerry, my photographer, said, "Well, I'll send it to you." So she ended up with all her photos back, which was gorgeous, because they were, as far as the family was concerned, they were gone. So, I mean, that was a nice little story.
Totally meant to be.
Yeah, absolutely. Well, I mean, sadly, we say terminally ill, and we say up to 5 years life expectancy. And I know a lot of people don't know how long they're going to last, or don't want to know, and that's fine and fair enough. But we've organised so many weddings where the wedding didn't go ahead because they were either too sick or they'd passed away beforehand. We had a lesbian couple a couple of years ago, and she died the day before the wedding.
Oh.
So yeah, it's just like so sad, because it's so close.
Yeah. So you're obviously Queensland based.
Yes.
So is this only Queensland based, your charity, or is it a national charity?
Yeah, no, we're national. And we are set up to go into New Zealand. Well, I got that done just before COVID, and then COVID hit, and then just everything crashed. Like, someone shot it. So we haven't done any weddings in New Zealand, but I am so confident with my network of marriage suppliers who are just big-hearted, beautiful people. I'm so confident with my network that if somebody rang me and said, I've got someone dying in, I don't know, Waikika over in, that's the only one I could think of, over in New Zealand, that I could pull a wedding together very quickly.
That is incredible.
Yeah.
Amazing networking skills. So obviously that day you reached out to a photographer and a florist, and all of a sudden you just had this wedding prepared. How did it then grow from there? Like, was it word of mouth? Did you get contacted again? Or was this something that kind of sat with you and you were like, hang on a minute, I want to do this and I want to help people that are terminally ill? Like, how did that kind of then eventuate into more and more, and then creating My Wedding Wish?
Okay, so what happened is I knew I was going to do something with this because it just resonated with me so much, hit all the feels. Anyway, I had to get my undergrad done, and then I did honours, and then I had just started my PhD, and I thought, well, I've got time now. PhD is not as heavy as what people think, and I actually had more time doing a PhD. So I sort of thought, you know what, I'm going to do something with this now because it's time. It's time that I did something. So that was, his wedding happened in 2007, and this was back in 2000 and maybe 11, 12, 2013 in June. And I jumped on Facebook, and in Sunshine Coast, in most major towns, there are secret Facebook groups, and we've got a secret wedding suppliers Facebook group on the Sunshine Coast. Anyway, so I jumped on there and I said, like, this is what I'm thinking about doing, pulling together a wedding for someone who's terminally ill, or just in tragic circumstances, whether the house has been blown down by a cyclone, or just somebody that needs a hand up type thing. And within probably no word of a lie, within 10 minutes, I had a $30,000 wedding organised. And I've gone,
Wow.
oh, wow. So then I contacted the media and I said, okay, we're opening it up. This is about in June. The wedding that we've picked is the 11th of December 2013. Didn't even realise it was an iconic date, but there you go, 11, 12, 13. So it got blasted all over Sunshine Coast, and we had about 11 applications. And from that, Chrissy and Nathan were picked, and I'll tell you their story. It's just it's bloody heartbreaker. Sorry. From there, My Wedding Wish kind of grew, and it started as a local project, and then I started getting, people from Canberra saying, "Hey, do you do this in Canberra?" And I thought, like, why not? I can do it in Canberra. It's a couple of phone calls. How easy is it?
Yeah.
How easy is it to help somebody? It's easy to be a kind person.
Absolutely.
So,
You've got kindness oozing from you, 100%. Is it yourself that you're going to every single wedding, or do you have a team of celebrants that are a part of My Wedding Wish?
So if somebody from Wagga contacted me saying we've got somebody, I would contact. What I normally do is, first of all, I look in at our spreadsheet. We've got about 1,800 wedding suppliers nationally registered to jump on board. But normally I would, and we've got wish leaders in every state. So we've got a Queensland wish leader, New South Wales wish leader, and I normally dump on that person because they've got their own networks that are in some cases broader or more narrow than mine. I normally contact the celebrant because that's my base, and we do the legal stuff, so it's really important. And I will say, okay, I've got a wedding. They want to get married ASAP. It could be palliative care. It could be chapel. It could be who knows what it's going to be. But are you available? We don't charge the couple, so everybody knows that it's a gifted type thing. And then we sort of say, can you pull this wedding together? And so the wish leader normally coordinates and pulls together the makeup and hair and makeup and what have you. And some of these things, a lot of them are palliative care, hospital bed type things, or the hospital chapel. And other ones, they've got a lot of time to plan these things, and they're 2 years planning their beautiful dream wedding. But basically, I don't do them all, and I don't want to do them all because then people would think, oh, it's about her, and it's got nothing to do with me.
Yeah, that's what I was thinking. I was like, are you the one at all the weddings? Because that's going to be hard for you. You already have 5 hats on.
I know. I quite frankly, I couldn't handle the emotion.
Yeah, it is a lot. Like, I even feel like that story from your first encounter would have just been such a wave of emotions. Like, that would have stayed with you
Mm.
forever. And I'm sure every single one you've been a part of has affected you deeply.
Oh, look, it's one of those things you sort of think, be a professional, don't cry, don't cry. But some of them, I mean, I married this couple, and he worked in the mines over in Western Australia, and he collapsed at work, and so they've sent him to the doctors or the hospital, and they gave him a series of tests, and they found out he had a glioblastoma, which is a brain tumor. For your, I'm not telling you people how to suck eggs, but so the family went over, and he was operated on, and they got rid of it, but it was very aggressive. And within maybe 3 months or so, it had grown back to probably bigger than what it was originally. And so they said, we can only operate one more time, and like, that's it, sort of thing. And so it would have given him an extra 6, 7 weeks or 8 weeks or something like that if it was continued to grow back so aggressively. So they chose to, and they had 2 tweens, not twins, they're pre-teenager young girls, and they just lived locally on the Sunshine Coast. And she'd contacted me, and I said, yeah, absolutely. So I'd organised the photographer. She was a hair and makeup artist, so she didn't need any of that and didn't need flowers or anything. So she just put on a pretty frock and did her hair, and I organised the photographers, and we stood in their backyard, and we'd done all the legal stuff and what have you. And I said, I say, repeat after me for the legal stuff. And then I said, is there anything that you'd like to say to each other? Oh, God. I had tears. And I just sort of thought, you can only be authentic. You can't not be authentic in a time like this. And he said to me, didn't say to me, he said to her something like, the moment I met you, I knew you were the love of my life. The love of my life, and it was just like, you're like, kidding me. I can't even deal. So everybody, the photographers would, I was a mess as well. So there was a lot of leaky mascara that day. It was so sad.
Even just hearing the story is making me tear up. I can't even imagine setting foot in that backyard.
Yeah, I know, they're just so ridiculous. And I look at these photos with such fondness, and it's so sad. But he just wanted more time with his babies.
Yeah. You must have such a collection of photos from every single wedding that you have helped. That must be so amazing to go through all those photos.
Oh, absolutely, absolutely. Just beautiful memories, and it's not necessarily for the person that's passing, though it is. It's for the families. Like when we've got small children, I try and get videography as well, because that's the last memory that they will have of Daddy being alive. You know what I mean? Or
they're going to treasure those photos and treasure those videos.
Oh, absolutely.
So much.
Yeah.
Wow, that's absolutely incredible. Like, even I've got goosebumps. I'm teary. I'm like, oh my goodness me. So you mentioned that you've got like 1,800 like suppliers within Australia alone that you can reach out to. Is that like, are they just all coming to you? Is this through Facebook and word of mouth, or are you actively going out there trying to find sponsors?
Look, I was, but now I'm not, because it's a sad indictment on us. I don't know. It's just one of the things that I go, oh wow, this is a really warped way to look at it. But somebody will say, I want to be a supplier, and they're all keen and all gorgeous, because that's, we're in the wedding industry, we're in the love industry, and we love by and large. And then somebody will contact me saying, well, it's been 3 months since I registered and I haven't done a wedding with you yet. Like, what's the problem? I go, dude, nobody's dying in your area. You should be really pleased. It's just a different way to look at it, I guess.
Absolutely.
Because there's different reasons that people volunteer for something like this. They volunteer, just to get on our website or things like that. But that's there's no judgment about why anybody does anything. But I don't do it for any other reason that I can.
Yeah. One of your many hats that you're working on.
That's
following your passion.
That's the one with the sparkles on it.
With the sparkles on it. Oh, I love that so much. So I think with the listeners that are like listening to this podcast now, if they want to help in any way, obviously you want support from businesses and things like that. If you're just an individual person wanting to support My Wedding Wish, how can they do that?
If you are a bride or a groom and you're getting married, you could, instead of buying a little gift for everybody, little sweets or something, you could donate to the charity on everyone's behalf, and just put, like your gift to us, or our gift to you to say thank you, is to give to this charity, and that helps spread the word. So we sort of love that. A couple of couples have said, in lieu of gifts, please give a monetary donation to us, and we'll pass it on to My Wedding Wish, which is greatly we love that, because we're a business. I've got registrations, I've got insurances and things like that. And when COVID came, we had a company called Easy Weddings, which any of your couples who are brides or want to be brides, that's where one of the places that they go to stock, wedding supplies and things like that. But they were donating $3,000 and $4,000 per couple of months to us, and that bolstered, and so therefore we could get more printing done and what have you. And now all that money's gone, because the wedding industry was crushed during COVID because of all the lockdowns. Nobody could get married. So a lot of people contact us and say, oh, can I donate my wedding dress, or my bridesmaids' dresses? And we just don't have the facilities to hold them. So we do have some, but they are in like it's just stored in a house type thing. And when somebody contacts us and says, I want to get married, and their application is accepted by our board of directors, we sort of say, do you have a dress? And they say, no. Okay, what size are you? Pick from the dresses that we've got in the galleries, and pick one, and we just post it to them, and so there's no cost to them. So the gowns that we do get, that we often accept, their brand new gowns from people people who are just rolling over their stock, to the next season sort of thing. Because, when you're getting married and, like you're pushing together a wedding, you don't really care about what season's style is. You just, that's like, you don't care about what colour flowers, that's the last thing on your mind. You care about being married to the person that you love, which is what marriages should be about. It's not about the apricot flowers or the colour pink, it's
the colour scheme of the day.
Absolutely,
or the entree.
Yeah. And you start to think about what is important.
Mm-hmm.
And like that ain't important. That ain't it. It's seeing the love of your life at the end of the aisle. That's what's important.
Yeah.
And one of the most touching weddings, I wasn't a part of this one. I just pulled it together. It was on the Gold Coast, but she has now passed. But one of the lines in her vows was, "I know we're supposed to say I will love you, until we're old," type thing. And she said, "I don't have the pleasure of being able to say that." And it was just like, or even the bridesmaids in the video, everyone's gone, like, wow, I don't believe she said that. But she actually said, the stuff that you don't say out loud, and it's really poignant, really poignant. So ladies out there, none of the other stuff really matters.
It doesn't, no. But you don't know that until sometimes your world gets ripped apart, I guess, and then you're in that hospital room. People honestly think they're invincible. Like we all do. We think we're invincible, and it's not until we're exposed to the medical world. Like nurses know, and doctors and healthcare professionals know that we are not invincible at all. And we see death, and we see, there's that horrible side. You mentioned that first story. It was 23 years old and he passed away. Like that is horrific. He's not even begun his life yet. He's still, early 20s. So I definitely I see this stuff and I always want to help, and I want to and it's so true. Some people would be getting married and just being stressed out about the meal or the entree and where the table should go and the seating plan. And at the end of the day, you just want to marry your person and be there with the love of your life.
Yeah. And,
seen some raw moments.
Yeah, absolutely. And end up arguing about what schools they go to, private or public, or end up, just you want to have fights about your future. Really, because when you look at fights about your future compared to dying, I don't know, I'd prefer to have a fight about my future. You know what I mean? And be there for my kids and like that, like this whole dying thing, it's pretty permanent. And it's not fair because they don't get that chance. Like when somebody who's 90 dies, I mean, and I think it's probably across the board, they've had a good life and a long life and what have you. And, but when you're 23, I mean, my youngest bride was 20.
And I was going to ask you what your youngest was.
She was a Brisbane bride, south of Brisbane, and she had a sarcoma in a cheek, and they had to take it out, but when they took it out, they had to remove her eye, and they had to remove part of her jaw so she couldn't open her lips or anything like that. And she ended up getting a prosthetic. They were glasses, but they had sort of an eye on the back of them. But when you look at the photos, she looks like she doesn't have her eye removed, but she had to have a full face kind of removed. And it was, she's such a pretty kid. And she, talk about a strong girl. I did her funeral as well. And her mother threatened me, don't you cry at my girl's funeral.
Oh, lots of pressure.
It was very scary. Yeah, but anyway, it was a beautiful funeral. It was a stunning wedding.
Yeah.
We had they had that on. I'm sorry if I'm waffling. They had that on a property, and there was about 100 guests. They had all of everybody that they'd ever met there, because they were and they are still a really solid family, and I love seeing that. And this snake made its way through the crowd, and it was like a Mexican wave that everybody jumped up with their arms in the air and what have you, with this snake running through the crowd.
Oh, wow.
It was hilarious. It was hilarious. It was one of the things that we talked about, and it got a mention in the funeral as well.
Mm-hmm.
That, that's just who she was. She's a fabulous kid.
I love these stories. Like, hearing you and seeing you tell these stories, you can just see how much it affected you and how much you just loved being a part of that journey and helping that family and having that bond forever. Like forever and ever, you're going to have that bond with that family, and they will always remember you and what you have created, for sure. I love these stories. Don't ever say, sorry for waffling on. I was like, my God, waffle away. I want to hear this. This is incredible. Like, what you have done, honestly, is incredible. And with all the hats that you wear, I love that you say that this is your sparkly hat, something that is quite raw and emotional and really, really hard to get through. I love that your mentality is like, this is my sparkly hat job. I've got the sparkly hat, and I've got to put on that face, and I've got to marry these people, but I'm still going to be raw and in that emotion and just be authentically a part of it as well.
Yeah.
Beautiful.
When with that first wedding, not the young boy in the palliative care bed, but the first one after I suggested that, I pulled together this $30,000 wedding, he actually said to me, or I think it was the bridesmaid, she said, just for a day, she's not a girl with cancer. Mm-hmm. Just for a day, she's a girl without cancer, and she's a princess. And you could see that it meant the world to her. It absolutely meant the world to her. And she didn't have cancer that day. Yeah.
You gave her that wish. Wish was granted.
Yes, absolutely. Yeah.
Oh, I love this so much. I feel like I'm just going to have a little cry after this episode. So with the listeners, where can they find you? Where can they support you? Let them know all the details so that they can listen to this section and actually, reach out to you, reach out to your organization and spread the word. Because as I said, there's a lot of healthcare professionals going to listen to this. So they'll be able to have those chats with, people that are in palliative care and have chats with doctors and nurses to just spread the word. Because that's what I want, is I want the word to spread so that we can get some funding for you and that we can let you keep growing and helping all these people. Yeah. Where can they find you?
The website is, sorry, itchy eyeball. The website is myweddingwish.org. And we're on Facebook under My Wedding Wish, and we're on Insta, but because there's only me that's doing it all. So I have had to let social media stuff fall. But if anybody's does do social media and they want to help us out with that sort of stuff, so there's ways to donate. We often get people from the community going, "Oh, I heard there's a wedding on. Can I come and wash dishes for you?" Because what we do is tangible. So you could give some money to feed the people over in Africa, the young kids and what have you, but you don't get a sense of it. But with what we do, it's tangible. You can see the flowers that you've created at the wedding, and we invite all of our suppliers to actually come to the wedding, not to the receptions. But it's a tangible gift. You can actually see it and feel it and smell it and touch it, and I think that makes it so raw that here is my gift and I can see it happening. Yeah. But if anybody wants to donate funds, that would be greatly accepted. I've had a couple of emails from hospitals saying we need more brochures, and I just don't have the money to print them at the moment. So it's just stuff like that. And people go, I don't want to donate to brochures, but without the brochures, people don't get to hear about us. So I think Brochures are pretty important for us. But, the majority of our weddings come from social workers at hospitals. So thank you guys for that. Yeah.
Perfect. Well, we're going to spread the word for you. I'm going to
Thank
spread
you.
the word for you.
Thank
I'm going
you.
to get my wedding wish out there so you can keep being a part of this journey, because we need it. We need someone like you who's got that ginormous big heart that's going to put on the sparkly hat and help others. And without you, this wouldn't happen. So everybody, just even chip in $5. $5 is nothing. $20. Let's print some brochures.
Yeah, let's get some brochures printed. Oh, exciting.
Something so simple. Well, thank you so much, Lynette, for giving me some of your time today. I know you're such a busy woman, but I so appreciate it.
No worries, Jess. Thanks for having me on. I really appreciate it.
Thank you so much. All right, everybody, make sure to give us a 5-star review and head on to myweddingwish.org now and just donate a little bit of your funds or get talking with everyone around you. All right, bye, guys.